Welcome back, everyone, to the GuideWell Insights Lounge. My name is Kate Warnock, and we're coming to you live from day one of Singularity University's Exponential Medicine. I'm delighted to bring another guest here to the Insights Lounge. His name is Dr. John Mattison. Dr. Mattison, welcome.
Thank you.
Dr. Mattison is the Assistant Medical Director and Chief Medical Information Officer for Kaiser Permanente. So, Dr. Mattison, being here immersed in exponential medicine, I'm sure that we're hearing about exponential technologies. What is it that you envision is going to be the future of health 5 years from today?
So I like to think of using modern technology to really restore ancient wisdom and bring back the human side of medicine that has been very much subjugated in the last several decades. And bringing the human touch back is not incompatible with technology. Quite the contrary. I see many ways where technology is going to assist that. For example, today, if you come in with a particular problem, your doctor has pretty much a cookbook approach for what to do. But in the world of personalized medicine, in the world where we have big data analytics and we know your genome and we know your health record and we have tools to analyze it and craft a plan that is ideal for you, we may actually have multiple options for what we can do for you. So I like to think of it as say a 45-year-old woman comes into the office and she has new onset of high blood pressure and new onset of diabetes. We can offer her several different options. One would be, you need to change your lifestyle. The ideal one is you need to completely watch your diet, your exercise, your sleep, the health of your social relationships, and we think that your diabetes and your high blood pressure go away with that alone. Option 3 would be take a pill and come back in 3 weeks and call me if you have any problems. And option 2 would be somewhere in between those two.
Right.
What I think of is we need to be able to offer to the individual what options are. And in this case, I envision her saying, you know what, my daughter's getting married in 3 months. And I really want option 3 until my daughter's married and I get the in-laws out of town, and then I want option 1. And I want to be able to select the option that reflects my personal values and objectives. And so where technology comes in here is we can define very, very customized options, not just one, but several, and then we can use other psychometric testing and value assessment tools to very quickly arrive at a framework that provides the options in very accessible terms to the patient. So you don't have to do an elaborate spreadsheet to say, here's what happens with option A, here's what happens with option B, here's what happens with option C. But how do we use visualization tools to do the mashup of what their values and objectives are with the options as we define them using very sophisticated analytical tools and decision support to match the universe of knowledge about people and the universe of what we know about that individual, the small data about that individual. So it's really about personalizing options in a way that resonate with that individual. The other thing that I see that technology is going to really deliver that will be very personalized is not just what we tell people, but how we help support them in reaching their goals. Mm-hmm. And it's how we communicate. We have so many modalities. We can use email, we can use face-to-face visits, we can use telemedicine, remote visits, we can use applications on the smartphone. We have so many different ways of doing it, but there will never be a one-size-fits-all. So we need to be able to use a learning system that tells us what works best, how, when, why, and where, and how often we communicate with individuals to help support them in their values and objectives to reach their goals for health and wellness. And those same principles apply for creating wellness and creating resilience so that people don't get sick in the first place. So all of these very sophisticated, complex technologies can really reside in the background and support the human aspects of what an individual wants and how they want to get there.
So I think what you described for us, Dr. Mattison, is that's a future I think anybody would embrace. I wonder though, how do we get from here to this future that you just described when perhaps today's medical education doesn't necessarily emphasize that personal connection, doesn't necessarily give us or give the physician, the clinician, meeting with that patient, the right vocabulary to use. So how is it that we really bridge, from our present state? You mentioned a variety of different ways that we can be doing, maybe more visual, maybe, again, simplifying the language, maybe making it much more of a collaboration. How do we really set that up in today's clinical practice so that that future isn't so far off?
So there are a series of steps that we've already taken that have had a profound impact already, but they're initial steps, walk before you run. So the first thing we did is we gave people access to email their doctor. And so we have 30,000 emails a day between patients and doctors. The next thing we did is we allowed them to look up all their lab results and all their appointment reminders and so forth online. And the third thing that we're rolling out right now is giving them full and complete access to their health records so that when they see their physician or nurse or physical therapist or any part of this larger healthcare team, and the future is much more team-based care than doctor-patient. As soon as they're seen, the progress note goes directly to the medical record as well as to their personal health record simultaneously. In addition, at the beginning of next year, just 2 months away, people will be able to download their medical record with a single click online, so that there's much more of a shared base. And initially, a lot of physicians are afraid of exposing everything that they write in the chart, worrying that people will be confused or anxious about what they put in there. As it turns out, that hasn't been a big problem. And quite the contrary, when they see a term that they don't understand, when the doctor says they have SOB, they want to know the difference between shortness of breath and what most lay people think of as SOB.
That's right.
So what do? They Google it.
Right.
What happens? Next time they go in to see the doctor, they know exactly what the doctor's talking about because they Googled every jargonistic word that shows up in the medical record. So patients are actually loving the fact that they're not getting a distorted view of that. So the next phase, so that's the sort of the third phase. The next phase is to have a completely shared medical record so that there is really the ability of the patient to easily make entries into that and for there to be much more shared decision making, not just with the physician and the patient again, but with behavioral health care workers, with nurses, with the physical therapists, the pharmacists, and really have a shared discussion. So there's really 3 discussions that I see, and I talked earlier about how we need to have visualization tools to make it really easy for someone to sort of get an idea of this is where you really have to, break a sweat and change your lifestyle. This one's a lot easier and something in between. But how we use those visualization tools is going to support 3 very distinct conversations, all of which are critical to the health of an individual. The first conversation is between that individual and their healthcare team, not their doctor, but their whole healthcare team. The second conversation is between that individual and their personal support structure. So they may have hypertension and they may have a support team of people in the community or people online that help support them in managing those things that are necessary to reduce their stress and lower their blood pressure. They may have a problem with smoking and they may need to quit smoking. And they may have a different support group for smoking. But we want them to have access to all of their information so they can share what they want with whom they want to get the support from their community in order to help manage their own health. That's the second conversation. The third conversation is between the patient. How many of us have had an elderly relative come home from the doctor or from the clinic or the hospital and you say, "Grandma, what happened?" "I don't know, I was so nervous. I don't remember anything the doctor told me."
Right.
So there is a person, a whole person, that lives in a community and a household that when they're sick, they become a patient. And when they are a patient, they may not remember everything, there may be a bit of anxiety. When they leave that setting and go back to be their whole person, there's a dialogue between the whole person and that persona within them that was a patient. And it's my belief that these visualization tools, based upon values and objectives and an array of different ways of making that information accessible, will support all 3 of those conversations. Because health is a very, very social construct. Whether you look at what's been written in the blue zones about why various communities around the world people live longer, healthier lives, Or whether you look at the brilliant work done by Nicholas Christakis and James Fowler in the book Connected about how our health is so directly determined by our friends and our communities and our social networks, even before Facebook ever existed.
Right.
The evidence that they presented is overwhelming that our communities have a profound influence on our health. So we need to broaden the concept of health to a concept of resilience and community-based support for healthy lifestyles. Most of the problems we have in healthcare today are related to disorders of lifestyle, and being able to rally a larger community and bring those social forces to bear on the health of every individual and the wellness and the resilience of every individual is critical. And the last thing I'll say on that issue is that we need to focus a lot more energy on our children and on parenting, because there are many studies now that have shown that early childhood stress of various sorts, even in utero stress when mom's pregnant with them, or whether they breastfeed or not, or whether they have prolonged stress thereafter, or whether they're given too many antibiotics, their brains on an MRI 10, 15 years later are functionally and anatomically different, and they resemble the brains of people who have chronic anxiety and depression. So there's a redistribution of gray matter that bears out. So we need to spend a lot more time and energy focusing on parenting and early childhood experience to build more resilience into every individual, because life delivers curveballs to all of us. It's not as much what life delivers us, but how we deal with it. So building a much stronger foundation of resilience through parenting and early childhood experience, I think is going to create a much more resilient, healthy population that does not have to rely on healthcare the way that everybody does today because of our disorders of lifestyle.
You know, so I think, Dr. You're such a fascinating conversation. I think what you do for us is you really, you kind of project out, this is where technology can take us, but you also make it seem like a part of a very organic structure, a very organic approach to someone's health, because, as you said, health is social, and we do not operate in a vacuum. We're really at our best when we do have those various support networks, whether it's a team-based care environment or our own family, or an online chat that might be helping us. So, my last question for you, though,
Sure.
How is it that we scale, including the patient's voice, and how we deliver care? I don't know if you follow social media, but that is such a very, very large and important conversation where people really want to feel engaged, empowered, and part of how the care that we deliver today, how they receive it. How do we scale it?
So let me start by saying that I like to distinguish the hype and the buzzwords from the reality. So there was patient, we've had doctor-centered care in the traditional sense, so then it became patient-centered care, then it became consumer-centered care, then it became patient activation. And really, I think those are all great buzzwords and great concepts, but they don't really convey, in my way of thinking, the whole opportunity. What I like to think of as creating a behavioral symphony of wellness, where all of us are subject to all of the behavioral cues in our environment. And we need to really shift the needle on the environment where there are much more pervasive forces that lead to health and resilience and wellness. So how do we bring the individual more into the forefront? I think we need to have a much greater consciousness in general around what our children see in marketing and advertising, that whether it's for unhealthy habits or for unhealthy foods. I think we need to be able to engage parents very much in having a much more direct role in overseeing what kind of cues are being received by their children. Mm-hmm. And I think that each of us has to have a much clearer picture of what it is that we can do for ourselves and those around us. So I think one of the things that's really missing from the discussion is the role of empathy and compassion. And I think that we can use modern technology to restore some of the kind of empathy and compassion that characterized that country doctor of 100 years ago, that characterized healers of 1,000 years ago, that characterized tribes and small communities of the past. And we've lost so much of that today. And so I think we really need to bring back a sense of community. And while social media absolutely, getting back to your question about social media, absolutely has a profound influence of health and can be a multiplier. And what we're doing some interesting work in that space to use social media to amplify messages of wellness and health and resilience. There's some really fascinating research that has shown that the typical tribe in Aboriginal times was between 100 and 200, and when it hit 200 it splits in half and grows again. The same exact thing is evident when you do analytics on Facebook. People only have about 200 friends. So the scaling of this still has to be at a level that is accessible to the human psyche, which has evolved around tribes of between 100 and 200 people. So how do we really work with local communities as well as with larger communities a la Facebook and Twitter and so forth? So I think part of it is developing a zeitgeist that's healthier, and I think we need to engage a lot more celebrities. I think almost every celebrity would be willing to lend their brand, whether they're movie stars or athletes or whatever, to delivering more healthy message to change the zeitgeist around health. And some of that is happening, but I think it's really very underutilized as a mechanism. But then in terms of changing health of individuals, I think really engaging people in their own communities, in their tribes, to really change what they do to advance their health and resilience is important. And the other thing I mention to people is, if you're in a community, whether at work or at home, where there are people who are really toxic and not good for the health and resilience of the community can come together and through empathy and compassion really help to move the needle on that. And I think social media can be very helpful in that regard. But if that doesn't work and you're in a very toxic work environment or community environment, move, get a new job, leave. The evidence of the social impact on health and the social determinants of health is so profound that if you have the option to move, great. And then finally, I think we can use a lot of the technologies to do much more evidence-based assessment of micro-communities. Because if you look at a health map of a geography, and we've done this extensively in the San Francisco Bay Area, looking at our members and the distribution of asthma, the distribution of obesity, and the distribution of heart failure, it's not like one community is worse at everything. It's like there's different communities that have different fingerprints of problems. So how do we apply technology to become much more community focused? I believe population healthcare is a term of the past. So population healthcare basically says, okay, we got 10,000 diabetics, how are we going to treat these diabetics? What we should be doing is abandoning that, going to the notion of personalized medicine. How do we treat this person with a whole array of what we know about them and their diabetes to give a very personalized approach to their diabetes. But at the same time, we need to apply the same kind of analytics and technology to look at the larger communities they live in and say, why is it that this community has more teenage pregnancy? Why is it that this community over here has more problems with drug addiction? Why does this community have more problems with asthma and heart failure? And we need to have a systematic, disciplined way of doing community surveys, validating that with the opinion leaders of the community using evidence-based technologies, looking at what their appetite is for addressing those problems, using an inventory of what tools we know and what foundations, whether they're federal or faith-based or non-governmental or state or local, and what are the tools that they have and how do those tools match the gaps that this community has, so we can construct both a sequence and an ensemble of tools to direct at the issues that are relevant to that community, where they have an opportunity to really improve and gain more resilience, and ultimately use those same technologies and analytics and tools to create the kind of resilience that community, so the next challenge that comes along they can deal with more autonomously. So we don't want to come in and fix a problem and leave. We need to create the roadmap, the sequence, the ensemble of tools to address those problems unique to that community, with the goal of leaving them more resilient and adjunctive resources for the long term when necessary. But health is very much of a social construct, and we need to think of it much more in terms of social, and social media play a role, but it's one role among many.
Right, right. Well, I can see how passionate you are, Dr. Mattison, and the fact that you are the Chief Medical Information Officer. I'm sure that you're poised to really make a change and really kind of move the entire model forward so that everybody benefits from something that you describe as holistic, really not scary, but something that we all would want to embrace. Who doesn't want to feel like they're part of a tribe and that their tribe is being taken care of?
Exactly.
So I appreciate your time so much today, visiting with us here at the Guidewell Insights Lounge. I would love to have you on again if we have a chance to have you debrief. My name is Kate Warnock. We'll be back again soon. Thank you.